That's recording. Okay. Today is June 5th, 2020, and this is a continuation of our series, Spilling the Tea on Environmental and Social Health. Last year in 2019, we did a series on spilling the tea on emotional health, and the year before that, we did on mental health. Why? Because holistic health goes beyond just drinking a cup of tea. You would be surprised how many people are asking us, can we get a tea for anxiety, a tea for depression? This COVID-19, everything's that's going crazy. I need to help. I need something to help with my health. This video series, Spilling the Tea on Environmental and Social Health, is a response to that. We're on Facebook Live and we're on YouTube Live, and we're recording this. If you like the video, give it a thumbs up right now. Our mission is helping people through the power of tea, and we do this through the content. So a lot of people are experiencing an intense amount of stress. Stress is the biggest killer out there. It's bigger than any disease, than any poor diet. Stress kills. And here at Zen's Tea House, we want to be able to share with you that if we start looking at environmental health beyond just the physicalness of the environment, how that can affect our overall wellness. Social health plays a part as well. They are two different ones. You'll be able to find the information on zenstea.com, just under the page resources. So, environmental health, how does our environment affect our health? Number one, if we are looking at how we respond to our environment, you don't have to try very hard to see that if you go to a toxic environment, an environment where there's a lot of loud noise, that even when we leave that environment, we can still feel the anxiety. Our ears will still ring. Our health is negatively and positively affected by our environment. There's tons of studies on workplaces where people, they get paid very well. The transit to go and to and from work is easy, but the environment, it's mean, it's angry, it's cold, and it, for whatever reason, I don't know, they feel it's okay to be there, but it affects their health nonetheless. And we need to look, if we're going to be looking at our health holistically, we have to understand that our environment will affect our overall sense of being. So what about if you're in an environment where things have changed, like schooling? A lot of people are really excited to go to school, but during final season, the environment, everything gets intense. There is no tea to help with that. There's no tea to help with the anxiety that comes from an environment where it says you have to pass this class, you need to pass this test. That intensity can negatively affect our health. What about hospitals? Maybe you have a great job. Maybe you're either out of school or you don't really care. You just live peaceful. Environments like hospitals can be very intense. I have a sister who's a registered nurse. I have a brother who's an RT. They both work in the ER at hospitals. And it can be very challenging to live a healthy life when people are dying. That is also an example of how our environment can negatively affect our health. So what are the solutions? What can we do to improve our health in an unhealthy environment? Or how could we change our environment? Number one is taking breaks, taking time outs. Going on a walk can be very healthy. Changing out the atmosphere, changing the type of people, how you interact with your environment. Change, like seasons, they happen, they come and go, and they're actually really helpful to our overall health. It helps us to get outside the idea that right now, this environment, it's not going to change. There's one thing in life, things are always changing. Maybe it's actually cleaning. Cleaning can be very therapeutic. Clean your room, clean your bed. There's a pile of clothes at my house. My wife always leaves it there, and no, not that at all. But even cleaning a mess can actually help our health. So those are some techniques that you can change. By the way, love my wife. She's great. She actually has her degree in health education. And if a lot of the information that's on this page of the notes that I'm taking is because of the notes that she took while she was in college. So health, environment, can hope understand that. You want more information, take a look at our website. But what about social health? Not everyone has a grasp on what is social health. Some people think it's social justice. Other people think it's our interpersonal relationships. Social health can be just the interaction I had with you guys. I was talking about my wife and the clothes. Social health is the interpersonal relationships. It's how we deal with conflict. It's how we engage with one another. Conflict resolution, dealing with stress. Our ability to connect with one another and build relationships. That is social health, and not everyone is on the same level. Some people, their perception on social health is a one way. Maybe you've heard this before. This is a one-way conversation. I'm going to talk and you're going to listen. That is not a very social. That social health, that's not really thriving in that sphere. It might be very effective at times, but a healthy environment, healthy social environment, is where we get to interact with one another. And if we don't have that, that can also negatively affect our health. I mentioned about working at a job. Maybe you work at a hospital and things are very intense, and you have people who are sick, and you could have the mass, but really your health isn't negatively affected as much because you really like what you do and you get to interact with one another. And even though things can be tough, there's this social health, there's this connection that can and often does supersede the environment. One of the challenges during this COVID-19 season is a lot of people have been putting on masks. They've been doing a lot of prevention, sanitation, but they've also done a lot of isolation. And when we isolate ourselves, we may be in a healthy environment, very sterile. But because we're not engaging with one another, we don't have that social development, we don't get to interact with relationships and family or friends or loved ones, our health actually depreciates. You hear that? You could have a healthy environment, but unless we're engaging in social health, where we get to build and express our emotions with one another, our health will be negatively affected. There's tons of examples of this. We live in I mentioned social media. We kind of dehumanize people in the sense that we could do a post, a Yelp review, and just say, it's the worst thing ever. Well, that is not a sign of social health. I'm a big fan of the Lakers, but I've also heard some people saying, if you're not a Laker fan, then you ain't a basketball fan. Whoa. That also is a sign of social unhealth. And also the last one, I think, is connecting with one another. We could be in an unhealthy environment. The plague can be happening right now. You could be living in the plague. You could be living in a toxic household. But if we're engaging in positive, recreational, loving, meaningful relationships, the environment has a less effect on our health. You could be eating healthy. You could be mentally engaging in learning. You can be emotionally expressing yourself. You can be self-reflecting. This is a mental and emotional health. You can have your background and a degree in social and mental health, psychology, sociology. And you could even have a very sterile environment, but the social aspect of living, you can't get rid of it. We're human beings. And because we're creatures, we're relational creatures, we would not be complete if we just said, well, we got our physical health fine, and my mental health, I got meds for that. There's some level of truth to that. If you want more information, take a look at the T for Depression YouTube video. We're engaging in emotional health. I have a healthy environment, but isolating, not engaging with one another, not building those interpersonal relationship skills, our health will depreciate. Hope you enjoyed this video. We hope you enjoy this content. yes, we do have teas that people use for all sort of health ailments, but more so we're concerned with producing content that contributes to your overall health. That separates us from virtually every other company that says, hey, you got a pain in your side, take this, or hey, you're anxious, buy that. There's no service that can be provided for the pain that people are experiencing right now. Again, this is June 5th, 2020. Hope you are watching this at a later date. But for those who are live right now, we're going to open up the questions. You can post you could stop that right there, Carmen. YouTube, we're all live streaming on YouTube. And I don't see any questions, so I'm going to lob that right there. And Facebook it is. Here we go. We have any questions on Facebook?